I have to say that the talk we just heard would be a great summary presentation for what I was going to say. What I'm going to be talking about are some things that I didn't expect to get into. When I started doing research, there were two things that I said that I would never do. I would never study the hippocampus, and I certainly wouldn't study development. And I'm going to talk to you about developmental influences on the hippocampus. So what I'm going to be talking about is some work that we've been doing in animal models and in rat models, trying to understand the biological basis of some of these psychiatric disorders. Now, of course, I know when I'm talking about something as complex as schizophrenia, and I'm talking about rat models, it's a big stretch. We don't know whether rats can become schizophrenic or if they're schizophrenic all the time, and we don't know if they're hearing squeaks, and we certainly can't get them to lie down on a couch and tell us about their mothers. But what we can do is take information from the clinical literature and try to apply it to different pathways in the rat brain, and then take what we find from that and take it back to the clinic. And it's this back and forth that seems to be really valuable in trying to understand what's going on. Now, what I'm going to focus on is the dopaminergic system. The dopamine system, this is a dopamine system in the rat, consisting of the medial area, which is the ventral tegmental, and the lateral area, which is the substantia nigra. The dopaminergic system is subdivided into segments. The most medial part is the part that projects to areas of the brain that are involved in emotional regulation. And this is probably the areas that are involved in anxiety, depression, and things like that. As you move to the more lateral aspects of the VTA, you get to areas that are more involved in cognitive control, higher functions. And then when you get into the substantia nigra, you get things that are more involved in habit formation and things that are involved in motor control. And we know that the dopaminergic system has a number of involvements in different disorders. We know that degeneration of the substantia nigra leads to Parkinson's disease. We know that an overactivation of the dopaminergic system can lead to schizophrenia. It also has involvement in drug abuse, and there's an emerging literature for an involvement in depression as well. And what we wanted to do is to really understand what's happening in the dopaminergic circuit. And to do this, we wanted to be able to record from the neurons and find a way that we could assess what's happening across the population. So what we did is to look at this dopaminergic system. Now, as you can see, if we record from a single neuron, we're not really getting a complete picture of what's going on, because we know at least half of the neurons are not firing. And the ones that are firing at different firing rates and firing patterns. So what we wanted to do is get a representation of what's happening across the dopaminergic neuron population. So what we do is, in the anesthetized rat, pass an electrode through this dopaminergic neuron population and basically count the number of neurons we see in each electrode tract that are firing. And this gives us a measure of population activity. Then we look at the neurons that we find, see how fast they're firing, and their firing pattern. Now, I looked at these different parameters because these are controlled by different circuits and seem to have different functional impacts on the way that the system works behaviorally. With respect to firing pattern, dopaminergic neurons in the baseline state fire in a slow, irregular pop-pop-pop type of firing pattern. But studies by Wolfram Schultz and a number of others have shown that whenever an animal is exposed to a behaviorally salient or relevant stimulus, dopaminergic neurons fire these bursts of action potentials. So the burst is really the behaviorally salient, rapid phasic output of the system in response to a stimulus. What it does is it alerts the brain that an important event has happened. Now, this burst firing is regulated by glutamatergic inputs coming from a brainstem area called the pedunculopontine tegmentum. This provides glutamate that acts on NMDA receptors that cause the dopaminergic neurons to burst fire. But NMDA receptors have a unique property in that the neuron has to be depolarized and firing for NMDA to be activated. If it's hyperpolarized, there's a magnesium block of the NMDA channel and nothing happens, which means only the firing neurons can be driven into the burst firing mode. The non-firing neurons don't, which means there's a way of regulating this fast phasic bursting output. Now this begs the question, what regulates the number of neurons firing? Well, this seems to be controlled by an area called the ventral pallidum. The ventral pallidum is a GABAergic nucleus. It's an inhibitory region that provides potent GABAergic inputs onto dopaminergic neurons, fires in very high frequencies. In fact, if you do in vivo intracellular recording from dopaminergic neurons, you hear this constant rumbling in the background from all of the iPSBs being driven by the ventral pallidum. What this seems to do is hold subsets of neurons in this non-firing state. If we inactivate the ventral pallidum, we remove this inhibition and the whole population starts to become active at its normal firing rate and firing pattern. What's the relevance of this tonic activity? What it does is it provides a level of amplification. Oh, I'm missing the bottom of the screen. So what we have is the ventral pallidum, as I mentioned, holds subsets of these neurons in a hyperpolarized state and controls the number of neurons firing. The pedunculopontine causes the firing neurons to burst fire. Burst firing is the signal, but the ventral pallidum controls the gain, or the level of amplification of the signal. The more neurons that are firing, the bigger the signal. The less neurons that are firing, the smaller the signal. And what we find is that this system probably plays a big role in the psychotic symptoms of schizophrenia. Now, in order to study this, what we did is to use a developmental disruption model. A lot of the research early on started with these acute pharmacological models that really didn't recapitulate a lot of what we needed to do to understand schizophrenia. Instead, what we did is to take a hint from the clinical literature. We know that there are certain vulnerable periods with respect to schizophrenia, and especially prenatally. The second trimester is a particularly vulnerable period in schizophrenia. Women that have severe influenza infections during the second trimester have a higher incidence of schizophrenic births. Women in periods of famine during the second trimester have a higher incidence of schizophrenic births. There's a higher incidence of schizophrenic births in the spring months, which correspond to the second trimester being over the winter, that's reversed in the southern hemisphere. We also know that there's a strong DNA genetic linkage to schizophrenia. So what we did is to give this compound, MAM, or methylazoxymethanol acetate, that's a DNA alkylating agent. And we give it to pregnant rats at gestational day 17, which is the rat equivalent of the second trimester. And when we look at these animals as adults, it recapitulates a number of the things that we can see that seem to be consistent with schizophrenia. So we see anatomical evidence. We see thinning of the limbic cortical structures, the same homologous structures that you see thinned in the postmortem schizophrenic brain. When you do stereology and look at the cell distribution, what you find is you're not losing a lot of neurons, but the neurons are packed closer together. The same thing that's been reported in postmortem schizophrenic brains. And also we see a big loss in a specific type of neuron called parvalbumin interneurons. As far as behavioral evidence, we see a lot of things that are also consistent. We see impairments in sensory gating called prepulse inhibition of startle that you can see in these MAM rats and you can see in schizophrenics. We see deficits in so-called executive function, the higher cognitive processes, such as reversal learning, extra-dimensional shift, which is sort of the rat equivalent of the Wisconsin card sort, and latent inhibition. We also see deficits in the so-called negative symptoms, things that are related to emotion, such as problems with social interaction. And we also see changes in the way that the animals respond to drugs. In some studies that were done back in the 50s before ethics were invented, they found that if you gave PCP to schizophrenic subjects, you got a strong exacerbation of the schizophrenia that lasted for weeks, compared to a normal person who would take PCP where you would get a psychosis that would last for a day. These rats are very sensitive to the effects of PCP. They also show an increased behavioral response to amphetamine. And interestingly, the amphetamine response isn't present prepubertally, only when they start to reach late adolescence, early adulthood. Now, this is consistent with the emergence of psychosis in late adolescence or early adulthood in human schizophrenia patients. Now, this increased amphetamine response is consistent for a role for dopamine in schizophrenia. And we know that there's a lot of evidence for a dopaminergic involvement in schizophrenia. All antipsychotic drugs in use today work on dopaminergic receptors. Almost all of them are D2 antagonists. Drugs that increase dopamine release, like amphetamine and L-Dopa, when given at high enough doses, will exacerbate the symptoms of schizophrenia in a schizophrenia patient, and in individuals, it can mimic some of the psychotic states, even in normals. And furthermore, schizophrenics actually release more dopamine in their brain in response to amphetamine. Now, how do you measure this? Well, this is done using PET imaging, using a radioactive ligand called raclopride. Raclopride binds to dopamine receptors with a rather low affinity, so it doesn't stick very tightly. But you can use imaging to measure how much of it is stuck to receptors in the brain. You then give a dose of amphetamine. Amphetamine releases dopamine that displaces the raclopride. The more dopamine that's released, the more raclopride is displaced. So you can actually look in a living human brain and look at the activity of their dopaminergic system. And what was found by Anissa Abeydarga, Mark Laruelle, Alan Breyer, and a number of others is that schizophrenia patients not only release more dopamine, but the amplitude of that increase is proportional to the worsening of the psychosis. So what we have is a nice identity between an overstimulated dopamine system and these psychotic symptoms of schizophrenia. The problem is, despite years of looking, we haven't really found anything wrong with the dopamine system. What we think now is the dopamine system is probably normal, but it's being dysregulated by other structures. And one structure that's really caught a lot of attention is the hippocampus. So in the MAM model of schizophrenia, there's a hyperresponsivity of the dopamine system that's at least analogous to what's observed in schizophrenia patients. And current clinical data show that hyperactivity in the hippocampus actually correlates with the psychotic state of schizophrenia, as done using metabolic imaging studies. Now, is the hippocampus hyperactive in our MAM model, as it seems to be in schizophrenia patients? Well, to do this, we looked at activity in the ventral hippocampus. Now, in the human studies, what they found is hyperactivity in the anterior hippocampus. In the anterior hippocampus in humans is the part that has interconnections with all the limbic and frontal cortical regions. In the rat, that's the ventral hippocampus. This has to do with what happens during phylogeny. In the rat, you have this dorsal ventral orientation of the hippocampus, where the ventral is the limbic hippocampus. But as you go up the phylogenetic scale, the hippocampus slides into the temporal lobe. So what used to be ventral in the rat is now anterior in the human. When we look at this ventral hippocampus in the MAM rats, what we find are the neurons are firing substantially faster. But of course, the hippocampus is a complex structure that depends more than on just how fast neurons are firing. Rhythmic activity really plays a role in the output, how the output regulates other structures and gates information flow. What we find in the MAM animals is we actually lose the low frequency 0 to 4 hertz rhythms that are critical for gating information flow in target structures. Instead, we get an increase in the higher frequency rhythms. So we're losing this functionally gated output and replacing it with more of a high frequency noise that's overdriving the system. Now, does this impact dopaminergic neuron activity? Well, when we look at our 3 parameters of dopamine activity, how many neurons are firing, how fast they're firing, and their firing pattern, what we find in the MAM animals is a doubling in the number of neurons firing. Essentially, every neuron is active all the time, without much of a change in the other parameters of activity, which means it's pegged in the maximal hyperresponsive state. Now, this is interesting because it actually correlates with clinical data. Studies done by Ollie Howes and Phil McGuire at the Institute of Psychiatry in London used a measure called fluorodopa uptake. Now, fluorodopa is a radio-labeled analog of L-Dopa that's taken up into active dopaminergic terminals. And you can get a measure of how many terminals are active by the amplitude of fluorodopa uptake. What they find in both ultra-high risk subjects, subjects that are showing subthreshold psychotic signs in schizophrenia patients, is that the fluorodopa uptake in the associative striatum is significantly higher in schizophrenic subjects, which means more terminals are active, which correlates with our studies showing more neurons are firing. So there does seem to be a good correspondence with the clinical literature. So what we think is happening is that the hippocampus is hyperactive. This overdrives the ventral striatum nucleus accumbens, inhibits the ventral pallidum, removes this inhibition, and causes all the neurons to fire. Now, it's a complicated circuit, but we could actually block this at every single stage. So we know that this is the circuit that this is happening. We also know that if we go in and activate the ventral hippocampus, we can bring dopaminergic neurons right back down to normal firing. Now, of course, what I've been talking about is dopaminergic physiology. Can this translate to behavior? Well, as I mentioned, in the MAM animals, with amphetamine, you get an increased locomotor response. If we inactivate the ventral hippocampus to bring dopaminergic neuron firing back to baseline, we also bring the response to amphetamine back to baseline. So therefore, we think that this hippocampal overdrive leading to increased dopaminergic population activity is the basis for the hyperresponsivity of the dopaminergic system. Not that the dopaminergic system is screwed up, it's being dysregulated. So these data show that in our MAM model, ventral hippocampal hyperactivity leads to a hyperresponsive dopaminergic system that we think underlies psychosis because it makes the animal or the organism hyperresponsive to any phasic, behaviorally relevant event. Why is the hippocampus hyperactive? Well, one of the most robust findings that's been reported in the schizophrenia literature is the loss of a particular type of inhibitory GABAergic neuron, the one that contains a peptide parvalbumin. This has been shown to show dramatic decreases in the frontal cortex and hippocampus post-mortem in schizophrenia brains. What we find in the MAM animals is essentially the same thing. A selective loss of parvalbumin-labeled GABAergic inhibitory interneurons in the hippocampus and the frontal cortex. So this seems to be regionally selective. Now the question is, why are we losing parvalbumin? There are two reasons you can lose parvalbumin. Parvalbumin is a peptide. It's metabolically expensive to make. Neurons don't make it unless they have to. And if they're not being driven, they don't make it. Of course, if they're dead, they don't make it. So is it because they're dead or because they're not being driven? Well, we actually took a cue from the epilepsy literature where this has been looked at very closely. And what they do is they counterstain for another marker, substance P receptors. Substance P receptors are constitutively expressed, which means the neurons always make them, unlike parvalbumin, where sometimes they make it and sometimes they don't. What we did is to compare this expression of substance P receptors and parvalbumin. What we find is early in life, in the prepubertal period, there's a loss of parvalbumin, but not substance P receptors. So the neurons are there, but they're not making parvalbumin. But when you get to the adult, both markers are gone. So somewhere between prepubertal state and adulthood, the neurons are being killed off. So in schizophrenia in the MAM model, interneuron dysfunction may be a primary drive of the symptomatology. And if we can restore interneuron function within these circuits, we could have an effective therapeutic strategy. In fact, there are a number of drug companies that are targeting that as a way of getting better treatments. In contrast, a real holy grail is not to treat schizophrenia once it occurs, to prevent schizophrenia from emerging to begin with. And one thing that's played a big role in this is stress. We know that stressful stimuli in schizophrenic patients will exacerbate positive symptoms of the disorder. One of the highest risk factors for relapse is returning a patient to a high stressful family environment. Also, early studies by Eve Johnstone and Robin Murray looked at children that were at genetic risk for schizophrenia based on family history. They put them through a number of psychometric tests to see who converted and who didn't. And what they found is the children that were hyper-responsive to stress were the ones that converted to schizophrenia later in life. And the interesting thing about stress is stress can damage parvalbumin interneurons, especially in the hippocampus, which are the neurons that are lost in the MAM animal and in schizophrenia patients. Now what about so the premise is, in normal individuals, we think that there are areas like the medial prefrontal cortex, something that we just heard talked about, that can control that red part of the brain, the amygdala response to stresses. But if it's not functioning correctly, if it's not online, what you're going to initiate is a cascade of events that can lead to increased stress and damage. So there are a number of studies from animals showing that stress activates the mesocortical dopamine system, the dopamine system that projects to these frontal cortical areas. They activate the frontal cortex, and that feeds back and inhibits the stress response. So you're in a stressful situation, you feel stress, you deal with it, and you come back down to normal. But if there's something wrong, either the dopamine innervation isn't working, the circuitry is disrupted in these regions, possibly through genetic influence or birth factors, you're going to get a dysregulation of the dopamine system, which is going to be stressful in itself. You're going to lose the ability of the medial prefrontal cortex to down-modulate that red part of the brain, the amygdala, which means now the amygdala is going to be hyper-responsive. That's going to cause more stress. The amygdala is going to drive the noradrenergic system in the locus coeruleus, which is a stress transmitter. All of these leading to glucocorticoid release, hippocampal damage, and so on in this reentrant loop where stress leads to more damage, leads to more stress. Now, are MAM-treated rats more stressed in this prepubertal state before they're showing any of these hyperdopaminergic symptoms? Well, what we find when we look at these animals prepubertally, so this is a stage where the dopamine system isn't hyperactive, they're not showing any of the cognitive deficits. What we find is if we look at them in a measure of anxiety called the elevated plus maze, this is where you have rats in a plus maze where there are two enclosed arms and two open arms. Normal rats explore all the arms. If a rat's anxious, it hides in the closed arms. And what we find are the MAM rats hide in the closed arms. So at baseline, they're more anxious. We also looked at foot shock vocalizations. Now, if anybody does animal behavioral work, you know whenever you stress a rat, they sort of splay out and stop moving, and it's called freezing. But they're not just freezing, they're actually screaming ultrasonically. Never do this in an animal room because you're going to freak out every animal there. What we found is with just small levels of foot shock, the MAM-treated animals showed much more vocalizations and much higher amplitudes compared to the controls. And finally, when we look at that red part of the brain, the amygdala is firing much faster at baseline in the MAM animals compared to the controls. So all of these indices say that at baseline, prepubertally, the MAM animals are anxious and hyper-responsive to stress. Now, if stress plays a role in this etiology of this pathology, what this suggests that if we can control the stress during this critical period, we should be able to prevent the transition. Now, how do we do this? Well, we can't get rats to do mindfulness training. They can't hold a yoga pause. They can't get them to say Om or anything like that. So what we do is do the simplest model. We give them diazepam or Valium. And what we do is we give this to the rats right before puberty, and just for a short period of time. So we get a dose of diazepam that will normalize behavior in the elevated plus maze, normalize amygdala neuron firing prepubertally, and then what we do is we give them diazepam, and we give it in diazepam-laced cookies. Diazepam tastes horrible, but if you put them in sweetened condensed milk on Nilla wafers, rats will eat anything. So we give them an exposure to just 10 days of diazepam, about postnatal day 30 to 40, which is prepubertal for a male rat. We then withdraw the diazepam, wait for them to reach adulthood. And what we find is the diazepam blunts the loss of parvalbumin interneurons, And it also prevents the activation in the number of dopaminergic neurons firing, and it normalizes the behavioral response to amphetamine. So by treating this stress early on, we seem to prevent the factors that lead to this transition to the hyperdopaminergic state. Now this is interesting for a number of reasons. As I mentioned, converging evidence from clinical and basic science studies suggests that the inability to regulate stress early in life can lead to pathological changes in the hippocampus that we think underlie the emergence of schizophrenia. Now the diazepam, we think, gave us an interesting hint. What it says is that if you can circumvent MAM with diazepam, MAM isn't causing schizophrenia. MAM is causing hyperresponsivity to stress, and it's the hyperresponsivity to stress that causes schizophrenia. And I would bet that we're going to find out the same thing with these different genetic loci associated with schizophrenia, that the genes don't cause schizophrenia, the genes cause the susceptibility to stress that then goes on to cause schizophrenia, which is why even identical twins only show a 50% concordance with schizophrenia, and at least a third of schizophrenia cases are spurious and not linked to a genetic background. Now, if this is true, what this suggests that if we take a normal rat and stress them enough during this critical period, we should get the same thing. So what we did is to take rats during this period that we gave diazepam to the MAM rats. So these are just normal rats. We either give them 3 sessions of restraint stress for 1 hour during this period, or daily foot shock during this period, or both stressors together, which is a lot of stress. Wait until they reach adulthood and see what they're like. What we find is this adolescent stress exposure is enough to cause persistent activation of the hippocampus, both 1 to 2 weeks after the stress exposure, as well as 5 to 6 weeks later when they're well into adulthood. Whenever we look at what happens with this prepubertal response, we actually get some differences. When we do the restraint stress, what we find is that they tend to be more anxious. The foot shock stress, not so much. In the combined stressors, they're anxious. When we look at a cognitive behavior, this is called novel object recognition, where you have 2 identical objects and then replace one of them with a novel object. Normal rats will start to explore the novel object. With cognitive disruption, they don't show the difference. Restraint stress doesn't impact this, but foot shock does, and the combined stressors do. But when we look at amphetamine-induced locomotion, only the combined stressors cause a big increase in amphetamine locomotion, and only the combined stressors cause an increase in the number of dopaminergic neurons firing, this dopamine population activity. Now, interestingly, when we look at which dopaminergic neurons are active, it's selective for the lateral VTA. Now, why is this important? Well, the lateral VTA projects to the associative striatum. And the associative striatum is the part of the striatum where you see increased fluorodopa uptake, increased amphetamine-induced raclopride displacement. That's the cognitive, associative related dopaminergic system that's hyperactive in schizophrenia. Now, does this happen whenever you expose an animal to stress? Well, if we do this to the adult, so we take an animal at postnatal day 65 to 75, which is early adulthood, and expose them to the same combined stressors, what we find is if we look 5 to 6 weeks later, we don't see any change. But interestingly, if we look right after the combined stressor, we see the opposite. We see a decrease in the number of dopaminergic neurons firing. In fact, this is what we see in animal models of depression, not animal models of schizophrenia, which means early life stress can lead to susceptibility to schizophrenia. Late life stress can lead to susceptibility to depression. So stress is going to impact the system by causing parvalbumin neuron loss. In fact, parvalbumin neurons are really at the center of correspondence between a number of models of schizophrenia. They're susceptible to oxidative stress. They're susceptible to increased amygdala activity, leading to neuronal loss. They're susceptible to neuroinflammation, all of which are hot topics in susceptibility to schizophrenia. Now, one thing that we know in a normal animal can limit the effects of stress is the medial prefrontal cortex, especially an area called Area 32, which is the prelimbic prefrontal cortex in the rat. This projects to inhibitory interneurons in the amygdala and blunts the response to stress. What happens if we lesion this area? Well, what we did is to lesion this cortical control area 5 days before the stress exposure. And now we just gave them foot shock stress, the stress that was sub-threshold for producing the hyperdopaminergic state. Interestingly, the prefrontal cortical lesion alone was enough to make the animals anxious during the prepubertal period. It made them as anxious as the mam rats. But now with the medial prefrontal cortical lesion, now foot shock alone was enough to activate the number of dopaminergic neurons firing, which it couldn't do when the prefrontal cortex was functioning normally. It also led to this, not only did it increase the number of neurons, not only did it increase the amphetamine response, it also increased the number of neurons firing. Again, foot shock in the sham lesioned animal didn't have an effect. After medial prefrontal cortical lesions, now the foot shock stress during the prepubertal period did lead to activation of the dopaminergic system. So therefore, the deleterious impacts of stress combined with factors predisposing an individual to the impact of stress may lead to underlie the susceptibility to schizophrenia. And this is critically dependent on the timing of stress. Exposure during adolescence can lead to parvalbumin interneuron loss and schizophrenia. Exposure during adulthood, the parvalbumin neurons are protected and it can lead to depression. And interestingly, schizophrenia and depression run together in families, which may mean that it's the increased susceptibility to stress that's the common factor, and when the stress occurs determines what kind of a disorder you end up with. So the increased response to stress, we think, may be mediated by a failure of the medial prefrontal cortex to control responses to stress. This may be the genetic variable that underlies the predisposition. And if we can identify susceptible individuals and intervene early enough, just like we heard in the previous talk, we might be able to teach people how to mitigate these impacts of stress. I'm not saying we should start putting diazepam into candy bars. We do this to rats because we don't have any other choice. But with humans, we can do mindfulness, cognitive behavioral therapy, teach them how to deal with the stress early in life and prevent these transitions. And then to thank all the people in my lab who did this work, especially Holly Moore, who developed the MAM model in my lab, Dan Lodge, who did a lot of the earlier work looking at dopaminergic neuron activity, Felipe Gomez, who's done all of the recent fabulous work on developmental disruption, and all the other people who were involved in my lab over the years. And thank you for your attention.
We have time for some questions for Tony, please.
Yes.
So, one question, two questions, actually. One thought I had was whether the program at UVM resulted in your schizophrenics emerging as freshmen. But from what you said, it sounds like to decrease that, people would need to learn mindfulness before puberty. It would be too late by the time they went to college.
It's probably never too late, but the critical time period is probably the ages around 10 to 15. Robin Murray said that probably one of the biggest risk factors for schizophrenia is the number of times a family moves when the child is between the ages of 10 and 15 years of age. And that's because whenever you move, the child is thrown into a new social environment where the social structure is already present and they have to break into that social structure. So it's an extremely stressful period. And having to reintroduce that again and again and again during this period is, of course, an incredible amount of stress. Interestingly, not so much in military families, because when they move, everybody's new. But in cases where you're moving into a stable social structure, it's an incredibly stressful period.
Yeah, I believe that some of Dr. Al Green's research indicates that exposure to marijuana can have some risk for some kind of spectrum disorder. And I wonder if you have any thoughts about that, and is it a constant effect on the campus or the neurons, or are these folks kind of selecting themselves out as people who are saying, I'm stressed to begin with, I'm stressed as to begin with, we want smoking marijuana, and it's also how that maximum involved.
Well, I mean, marijuana is a really interesting thing. Well, a number of studies by Robin Murray have looked at susceptibility. And what you find is the impact of marijuana isn't great unless there are other risk factors. If there are other risk factors, it's additive. Now, we actually looked at cannabis, or actually THC analog administration to mam rats and normal rats. The interesting thing we found is it made the mam rats less schizophrenia-like as adults, but it made the control rats more schizophrenia-like as adults, which is interesting because if you look at schizophrenics, the ones that started to smoke marijuana before their first break say that they smoke marijuana because it makes them feel better. After their first break, they can't tolerate it. And that's because marijuana has two components. It has the THC component that can be anxiogenic, and the cannabidiol component that can be anxiolytic. The problem is, marijuana has been getting stronger, which means you get more THC, less cannabidiol, which means the more anxiogenic components are increasing, the anxiolytic components are decreasing. So the current generation of marijuana is going to be much more disruptive to the individual.
Another exposure that adolescents have is to amphetamine from Ritalin and Adderall. And so how does that affect the susceptibility to schizophrenia and their susceptibility to stress?
Now, as far as Adderall, it doesn't, and methylphenidate, it doesn't really seem to have an impact on schizophrenia. Now, it depends on the individual taking it. There have been a number of studies that have looked at the impact of Ritalin on children that had severe ADHD. And what they found is untreated ADHD is a much greater risk factor for later pathology than exposure to Ritalin. Now, these are patients that need it. Now, you also have people that are taking it that don't need it, that are taking it for the activating effects. Now, that's a little bit more difficult because that's illegal. And if it's illegal, it's really hard to get a good epidemiological study. But I wouldn't recommend it.
One more question, Max?
So you talked a lot about the exposure to stress during that sort of peripubertal time. Is there any research looking at the exposure earlier and the effects on? I mean, we know there's certainly lots of research now on toxic stressors in really young kids, but I'm wondering at a more pathophysiologic level.
I mean, that's a good question. I mean, very young children are amazingly resilient. It's once they start to care that things start to really disrupt them. For that literature, you'd have to ask BJ or others because they're going to be a lot more familiar with it than I am.
The risk, intrauterine risk factors, have you looked or considered how that is
Well, Holly Moore has actually gone on to study this in a bit more depth. And the interesting thing is, it's not so much that schizophrenia DNA does show hypermethylation already, and the MAM is a DNA methylating agent. But what she seems to find is it's not the methylation itself that causes the problems, it's the DNA repair enzymes that come in and make mistakes. Because if you block certain repair enzymes, you don't get the pathology. So it seems to be that it's a cascade. The methylation leads to repair enzymes, leads to mistakes that lead to this increased susceptibility.